A year into the pandemic now, and the nation remains split on how to overcome COVID. The CDC now suggesting double masks, while others continue to downplay its seriousness altogether. So tonight, in a News 11 exclusive, we explore how it actually compares to the flu and what the latest studies show about masking up.
The World Health Organization still says the leading theory as to how one virus impacted everyone on planet Earth jumped from an animal to humans. The latest research showing it's very unlikely the coronavirus came from a Chinese lab. That's just one area of contention, though. Mask mandates and comparing COVID to the flu are some of the others that have sadly led to a divide in our nation. To date, COVID-19 has infected more than 100 million people and claimed the lives of more than 2 million people. For our region, Imperial County has lost close to 600 people, while Yuma County has surpassed 700.
We've watched it ravage our community and ravage, so many families. And so I think, if anything, that's a little frustrating, is that it's not just about one person, it's about our community. And, when I look at the COVID deaths, I think of, now more than 700 people won't be at the table for Mother's Day and Father's Day and Christmas and Thanksgiving. I think about all of those people in that manner, and that's heartbreaking.
The intensive care unit at Yuma Regional Medical Center still carrying a heavy burden.
In a lot of serious situations, patients cannot mask, and they feel like they're, suffocating because they're so short of breath. And so really protecting our staff, and then in turn, that will protect our patients.
Mika Naranjo says we still have a ways to go, and that includes wearing a mask for quite a while longer.
Please keep your guard up. Don't just wear the mask for yourself, wear it for others around you so that you're not, coughing or sneezing. And you could be infected. You don't know, right? Until you get tested or until you have symptoms. And so the more prevention we can do, the better.
But many people have an issue with making masks mandatory and would prefer it be a choice. I took to social media. One person writing, if masks truly worked, then why are we still using them a year later? Another saying, yes, maybe we should use them, but don't force me. It is my choice. Mika's answer to that, we must all comply in order to make a difference, and that masks need to be worn properly.
It's important to wear it completely over your nose, at the bridge of your nose and below your chin.
We should also point out, after a strict mask mandate, locally transmitted cases of the virus in China are near zero. Now, another person on Facebook says she's frustrated because she says she did the guidelines put in place all to protect us, yet still her whole family contracted it. And studies do show COVID isn't spreading wildly at grocery stores, but more so right at home.
Definitely small spaces and gatherings. Just remembering it only takes one person to infect a whole family.
As for those who compare COVID to the flu, there is simply not a lot of trust out there. Trust in our government, trust in our healthcare officials, and sadly, trust in the media. But I'll still do my best. COVID comes from the coronavirus. The flu comes from the influenza virus. So to start, these are two completely different viruses. However, both do affect the respiratory system. According to the Centers for Disease Control and Prevention, the flu appears within 1 to 4 days after exposure. COVID can take 2 to 14 days. COVID often elicits a more severe illness. COVID is more contagious and more deadly.
Over 36,000 cases of flu in our state. Currently in Yuma County, we're at 2 for the season. Last year, statewide, there were 800 deaths across the entire state. Versus this year, for COVID deaths alone, we're already past 13,000.
The CDC estimates that in the 2018-2019 season, an estimated 35 million people got sick with the flu, and 34,000 deaths were reported. Again, 34,000 flu deaths last flu season, while 468,000 people have died in the U.S. from COVID. We are also learning that in addition to the lungs, COVID can attack the heart, brain, sense of smell, and taste.
Flu admissions are typically pretty short term. People may be needing oxygen, maybe not, maybe just needing, some supportive therapy. But with COVID, definitely we've seen much sicker patients. They rapidly decline pretty quickly, and then they're in need of intubation, mechanical ventilation, and what's called, commonly called life support, because their lungs are not able to do the work on their own.
According to the CDC, there are only 155 confirmed cases of flu hospitalizations so far this season. So maybe all of the precautions we're taking are proving to help in other ways.
Increased hand hygiene everywhere, all the stores that you go, or restaurants, there's hand sanitizer, there's social distancing, there's masking. And so I think definitely all of those interventions have helped us to have, kind of a non-existent flu season to this point.
A lot of people online also had questions about why, even after you're fully vaccinated, do you still have to wear a mask? The reason for that, once again, is to protect others, not yourself. Even if you are fully vaccinated and have no symptoms whatsoever, you could still have and spread COVID. So while we are all exhausted by it, health officials say we must find it in our hearts to be selfless for the greater good.
One of our best stories was, having one of our ICU patients recover and walk out, and that was such a story of hope, and that's something that we want for every patient.
Most Americans say they will continue taking health precautions even after the pandemic is over. That's according to a new survey of over 2,000 adults conducted by Ohio State University. Nearly 3/4 of the respondents said that they will keep wearing masks in public even once the requirement is lifted. 80% said that they will still avoid crowds, and 90% plan to continue frequent hand washing and sanitizer use. Experts also predict some effects of the pandemic will stick around, like working from home and telehealth visits. Well, to help during